Somatuline Depot is a prescription medicine for adults with a type of cancer known as GEP-NETs that is spread or cannot be removed by surgery, and for the treatment of carcinoid syndrome to reduce the need for use of short-acting somatostatin medicine. It is not known if Somatuline Depot is safe and effective in children. Do not take Somatuline Depot if you are allergic to lanreotide. Visit www.somatulinedepot.com/HCP/PI for the full prescribing information and patient information.
My husband and I cook together, take turns on different menus, and do a lot of dancing in the kitchen together while we're prepping. Cooking every meal together and from scratch, I think helps our family have time at the end of the day to unwind. The healthy eating started because we wanted to cook with more natural ingredients. My name's Ann. I'm from Akron, Ohio. My husband's name's Ron. He is my best friend. We've grown up together, met in high school.
The first day of freshman year, I saw her and I was just like, oh, this girl is beautiful, wow. We've been together for 30 years, 22 years married.
In the beginning, I was misdiagnosed as IBS, and then once I started mentioning the flushing, I had a physician call it rosacea. You feel like you want to give up and you want to stop pushing and you just want to accept, oh, this is the new normal, that have something strange going on. But I knew it wasn't normal and I knew I needed answers. I was diagnosed in November of 2010 with a GI tumor.
When they found the tumor in her gut, I remember going, with her to the surgeon, and when they did the surgery, and I always remember the surgeon telling us afterwards, she's gonna outlive you, and that made me feel better.
When I was first diagnosed, it was hard to figure out what to tell my children because I didn't want to scare them. We presented them with, I had a tumor, I needed to have surgery, but it wasn't going to be anything that we couldn't handle.
What it means for Ann to have a family support system is that we're here to help her and get her through any struggles that she has.
GEP-NETs is definitely a misunderstood cancer because it goes misdiagnosed as other diseases for so long. The fact that it's rare, you do feel a little alone because there's not a lot of information out there, not a lot of publicity. The best advice to be your own advocate is you do know your own body and how you're feeling, and you know when you click with physicians. Sometimes you may have to get a second or third opinion until you feel you're in the right path. My tumors began to spread, and the specialist thought it would be beneficial to make the switch. My therapy change was to lanreotide, and that started in January of 2016. Side effects, I would say digestive upset or gas. Gotten creative in finding different bathrooms at work that during lunch I can maybe help those symptoms. The other symptom would be the effects on the blood sugar, and we're managing that with diet. The doctor discussed some of the side effects, but the benefits outweigh the side effects because it does slow the progression of the disease, and I'm able to work, I can play golf, I can do all the activities with the family and not miss out.
The advice I'd give a caregiver that's in a similar situation is that, just be there, listen. I think that's the hardest part, is the listening part.
My vision of the future is hopefully there's more research, more education, more knowledge and awareness so that patients are diagnosed sooner.
She's She's my rock. She's my everything.
My reason to keep fighting is for my family. I just think our story's not finished.
Love you.
Love you too.
Important safety information and indications. Do not take Somatuline Depot if you are allergic to lanreotide. Somatuline Depot may cause serious side effects, including gallstones, fatty stool, changes to your blood sugar, high or low blood sugar, slow heart rate, and high blood pressure. Tell your healthcare provider if you have symptoms of gallstones, fatty stool, high or low blood sugar, or slow heart rate. The most common side effects of Somatuline Depot in people with GEP-NETs, stomach area abdominal pain, muscle and joint aches, vomiting, headache, pain, itching, or a lump at the injection site. In people with carcinoid syndrome, side effects were generally similar to those commonly seen with GEP-NETs, including headache, dizziness, and muscle spasm. Somatuline Depot may cause dizziness. If this happens, do not drive a car or operate machinery. Tell your HCP right away if you have signs of an allergic reaction after receiving Somatuline Depot. Before taking Somatuline Depot, tell your healthcare provider about all your medical conditions, including if you have diabetes, have gallbladder, heart, thyroid, kidney, or liver problems, are pregnant or breastfeeding, or plan to become pregnant or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Somatuline Depot and other medicines may affect each other by causing side effects or affecting how the medicines work. Especially tell your healthcare provider if you take insulin or other diabetes medicines, a cyclosporine, or medicines that lower your heart rate, such as beta blockers. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Somatuline Depot. For more information, ask your healthcare provider and visit www.somatulinedepot.com/HCP/PI for the full prescribing information and patient information.